my name is Dr. Alia Tomaszewski with Align Chiropractic and Wellness. Recently, I opened a brand new practice here in Lake Forest, California, and today I'm excited to share with you a brief, informative video on chiropractic and how it can really help you and your family. So I'm going to break it down into three main parts based on the most common questions that I get when I tell people that I'm a chiropractor. And that is, number one, how does chiropractic work? Number two, how do you know if you should see a chiropractor and what are the benefits? And lastly, what should I expect if I were to go see a chiropractor? Those are the questions that I'll be answering today, and let's get started. What is chiropractic and how does it work? Most importantly, chiropractic is a branch of healthcare that really focuses on supporting your general health and wellness. It does this by removing nerve interference from the body. By removing nerve interference from the body, our bodies are able to function at a more optimal level. And after all, that's really what health is. Health is our body's ability to function and adapt to our environment. So how does this relate to our spines? So as a chiropractor, we're dealing with the spine, and when we think of the spine, we often think of it as a series of bones, but we don't always think about all of these little nerves branching out of the spine. So what is it that controls our entire body? It's our nervous system. Our nervous system controls and coordinates all human functioning. For any function to occur in your body, your brain has to signal down through your spine and out through these spinal nerves. And where do these nerves go? They go to every cell, every tissue, every organ. So anytime there's damage or interference to these nerves, it's going to cause dysfunction throughout the body. So as a chiropractor, I'm looking for spinal misalignments. Anytime you have a misalignment in your spine, it's going to directly interfere with the nerve coming out of it. So let's just take the two most common examples, neck pain and low back pain. Where do the nerves go coming out of your neck? They go down your arm and into your hand, and some of us may have experienced tingling, numbness down into your fingers at one time or another, and this is commonly referred to as a pinched nerve. But where else do the nerves go coming out of the base of your neck and upper part of your back? They're also going to your heart and to your lungs. So over time, when you have bad posture, if you have a job where you're sitting all day long hunched over at your computer, this really causes that whole area to compress. And not only is it restricting motion in that area, but it's compromising that nerve supply going to your heart and lungs, making those organs have to work a lot harder than they're supposed to. And eventually that starts to take a toll on our whole health. Also, when we take a look at our low back, same thing. Where do the nerves go that are coming out of your low back? They go down your leg and into your feet, but they're also going to your bladder, to your digestive organs, to your liver. And that's actually how I initially got into chiropractic. I knew nothing about it and I wasn't ever experiencing any pain, but I was struggling with digestive issues. And I got frustrated from seeing one specialist to the next specialist who were just trying to mask symptoms, and it really led me down a more holistic path where I went to see a chiropractor, and it was really with chiropractic care along with nutritional support that started to resolve these issues. So anytime you have a structural problem going on in your spine, just know that it's not just affecting that localized area, and that it's really affecting your whole body health. So how do we get these misalignments in our spine? They come from everyday wear and tear on our bodies. They come from the repetitive stress that we do day in and day out. They also come from trauma, and usually it's small traumas that add up and start to take a toll and start to weaken certain areas of our spine. And they also come from stress. Stress is the biggest contributor to chronic health diseases today, and it takes a toll on our body, and that also can weaken areas of our spine. So we work to repair any one of those causes that can lead to spinal misalignment. So number two, who is chiropractic meant for and what are the benefits? Again, since chiropractic works by restoring general health throughout the body, really anyone can benefit. I've seen everyone in my office from brand new newborns, infants, to patients well in their 90s, and everyone in between. And really, the younger and the healthier, the better, because then I can really focus on maintenance and preventative health. Because after all, it really is all about maintenance, and oftentimes we're really good about maintenance when it comes to our cars or it comes to new replaceable objects, and we're not always as good about it when it comes to our own selves. And yet it's so important because your spine is such a vital component to your overall health. And some of the benefits that maybe don't always come to mind beyond pain relief are everything from better quality of sleep, less stress and anxiety, better concentration and more energy, helps a lot with allergies and asthma and ADD. It can help with digestive problems and women's health issues, and also to support a healthy pregnancy, and it helps with a lot of children's issues like colic, chronic ear infections. Really the benefits are across the board depending on you, where you're at in your health. But that being said, it's never too late. Just because we like to see patients when they're young and healthy, but it's never too late to get on the right track to better health. Number 3, what should you expect if you were to go see a chiropractor? Every chiropractor is going to be a little bit different in their technique. In my office, the first thing that will happen is an in-depth consultation because we're looking at your whole body health. We'll then do a spinal analysis, a spinal examination, a few orthopedic tests and check your ranges of motion. We'll then report back to you areas of dysfunction that were found, and the most primary treatment method is what's called a spinal adjustment or a spinal manipulation. This just manipulates that joint back into its proper position, and in response it takes the pressure off the nerve, it decreases any muscle spasming or tension in that area and decreases inflammation. We'll then talk about an exercise regimen and also any rehab if necessary. But in addition to rehab, also things that you can do at home on your own time. Maybe a stretching routine to really work on prevention, or things that you can do at work. And then we'll also go through any nutritional needs that might be necessary because the two go hand in hand. We're looking at overall wellness, and just like nerve interference can cause a lot of issues throughout the body, so can an unhealthy diet. So that's what to expect. It's very customized towards you and your health needs. Just to wrap things up, number 1, how does chiropractic care work? It works by removing nerve interference from the body so your body is able to function at a more optimal level. Number 2, who is chiropractic for and what are the benefits? Chiropractic can benefit anyone because the focus is on restoring health, and the benefits are across the board from pain relief to an increased quality of life. And lastly, what to expect. A personalized treatment plan dependent on your health needs to ensure that you are in the best health possible. If you have any additional questions, please feel free to contact me at my website listed below, or if you're interested in scheduling a consultation, please give us a call at 949-783-0696. Thank you so much for watching this video. I hope you found it helpful, and please stay tuned for more videos to come.